The question of sort of how do we think about children's health care, children's health policy is one of those issues that has been, I would say, misunderstood for all the years that I've been working on children's health policy, which is a long time now. We tend to boil it down to CHIP, right? And CHIP, of course, is extremely important, and Congress fortunately extended the funding for CHIP back at the very beginning of February now, end of January, and that stabilizes coverage for about 9 million children. So of course there are an additional 36 million children or so who are in that part of public insurance that we know is Medicaid. And of course some of the CHIP children are actually Medicaid children. And so the much bigger discussion we are not having is the one that takes a step back and looks at the panoramic situation of children and health insurance in the United States today. And what you see is that, of course, we are in a very long, slow, but steady decline in terms of children's access to their parents' plans, and this very long shift that began as the decline became apparent toward children in public insurance. And so the discussion really needs to be more than just, are we going to fund CHIP, the little slice of public financing, but what can we do to make public insurance for children stronger? How do we make sure that children remain stably covered? How do we make sure that they get the scope of coverage they need? And how do we use financing to generate a movement toward health care systems that can interact particularly well with schools, child welfare, and other services that children use. Well, I would say lesson number one is the next time somebody comes along trying to sell you a Medicaid block grant, think twice. All of the block grant legislation, just like CHIP, which is really a block grant, tend to be time-limited blocks that have to be extended. And in the CHIP battle, which after all was a teeny tiny little, it's a small program and it was very tiny in terms of the overall funding, think about what would happen to states if suddenly the end date for $1 trillion program was reached. What would you do at that point? So I would say that the big takeaway lesson is that when the federal government tries to restate its partnership in indigent health care, as we'll give you some money and get out of your way, don't believe it.